Magandang umaga. It's already 12 noon Saturday. Good evening, good morning. Sorry. Good morning everyone. This is just a follow-up to our patient yesterday, Coco, a 3-year-old domestic short care. I'm sorry for the mistaken information or description of the patient. Coco is not a male, it's a female, spayed female. Okay? Of course, spayed female. So, Coco, history of Coco, according to the owner who has been constipation for the past 2 weeks. Okay? And a week ago, he was presented in our clinic for treatment and assessment. And based on the laboratory exams and radiographs, there is constipation or accumulation of stool in the colon. And still don't know the main reason or the etiology. And there's also a elevated white blood cell. Okay, so Coco was given some antibiotics and we prescribed laxatives. But Coco was again presented yesterday. They came back due to persistent constipation. But it's no longer constipation, but obstipation. No? The stool can no longer move or pass to the colon. There are different factors or several factors that might predispose for this condition. One is the diet or the lack of water intake of the patient, dehydration, or when there is some obstruction in the distal GI tract, and then another reason is when there's narrowing of the pelvic inlet. But as per the radiograph, we cannot include in the differential diagnosis the possible idiopathic megacolon because the diameter of the colon is not too big, to be considered as megacolon. And another reason is the behavior of the patient. The owner told us that Coco, as commonly seen in other cats, they are self-grown and possible the ingest a considerable amount of hair, so they develop hair balls. So as the patient continue to eat, so this fecal material becomes hardened as the stool within the colon. The colon absorb water, so the stool becomes like dehydrated or dry, less fluids in the colonic area due to the absorption of fluids. Oh. Yesterday we tried to manually extract those stools near the rectum, but we failed to remove even a small amount of fecal material due to the distance from the anus rectum to the fecal material. So we need to change our medication or approach to the treatment. But instead of manual deobstipation, we will now perform a what we call medical deobstipation. So medical deobstipation using a appropriate laxative in the form of PG 3350. I think PG 3350 is a reliable and used proven for the management of obstipation in cats. No? It replaces the laxative known as lactulose. Right? Lactulose is the previous laxative that we've been using, lactulose, but without precaution. Using lactulose can cause some complication like diarrhea. Lactulose is like a non-absorbable, absorbable laxative. So with PG 2050, it is a soluble fiber, right? Soluble fiber. So it's better than non-soluble fiber. I think so. We're trying to use this, but in previous patient many years ago, we have similar condition, but it's more on a megacolon because of the amount and volume of fecal material inside the colon, and on the radiograph it's much bigger compared to this patient. So today we will be using a saline solution. Where's the saline? Yeah. Ito, it's already, mixed with a PG 2050, 2 sachet. Ilang milligram?
7 grams.
7 grams each sachet. So 2 sachet, that's 14 grams, mixed with normal saline solution in a 500 ml bottle. With a regular IV drip, an adult macro IV drip. We'll be using this method to continuously provide this laxative via the esophagostomy tube. Yesterday, we did perform a esophagostomy tube placement. So, advantage with this method, although PG 2050 can be administered orally, but the problem with cats that it's not easy to administer medication orally. So based on studies, the median dose for PG 2050 is 80 ml per kilogram. The rate of 6 to 10 ml per kilogram per hour. That's the rate via the esophagostomy. Although also it can be administered via nasoesophageal, but nasoesophageal is a bit risky. Because there is report that can result to aspiration pneumonia when the tube is not properly placed into the nasoesophageal or into the nasal cavity into the esophagus. So with esophagostomy, the rest is not recorded with this method. So we start with the medication. So in the next 24 hours, expectedly there could be a result. Okay? Dala dito siya, no? Opo.
Yeah. Okay.
Okay. Mm. Thirty to 50, alright. Based on body weight, Coco is around 4.9 kilograms body weight. So using the dose rate of 6 to 10 ml per kg per hour, at least 30 ml per hour for the next 24 hours. So based on a literature, in the next 8 to 12 hours,
8 to 12 hours.
patient with this medication
12:07.
can have a result, good results, and start defecating, or because the action of the PG350 is to soften the stool. It is actually a stool softener, and it's safe for cats. This is actually used in human to manage constipation or prevent constipation. So here, this is the esophagostomy tube that we placed yesterday. So instead of nasopharyngeal, Toko is is stable for anesthesia. So we elected esophagostomy tube rather than nasopharyngeal tube for continuous and long-term this is para dito yan. Dapat dalawang mo. Yan. Nilagay na natin siya doon. So, gamit mo dito doon. So it's continue to drip. Open mo siya dito. Then, it's like an IV line. Similar to an IV line. Using an adult IV tube attached to the infusion pump. We can give a
So, 12 hanggang 8 o'clock mamaya. 8 hanggang 8.
precise infusion rate. But this time, this is not through IV, okay? It's through the esophagostomy tube. So, we also collected a large volume of urine, yesterday. The cause of straining and urination was due to the pressure from the colon, right? So we also place a catheter so patient can be able to pee.
Okay, wala naman yan. Hindi na bloated. Unlike yesterday, no, yung bladder ni Coco was full. It's not because there is obstruction, but due to the pressure applied by the large colon. Gusto niyo kumain? Hindi siya pwede pakainin. Okay?
Nalasahan yata yung anak.
Because meron siyang suppositomy tube. And do not give food, no, or water. Kasi meron siyang tube. So this tube now provides the necessary volume of the PG350 polyglycol, no, polyglycol 350 or the as a laxative. So we are now approach for the medical approach for the obstipation, not because the as we tried yesterday for extracting the fecal material was a total failure because we cannot remove by manual means. Okay? So, iwawait na natin ito doon sa page.
Ano ba yan? Ako, halka na.
Tingnan lang natin ito. Yun, natin off na.
Meron naman doon naka-ready.
Stop lang.
Okay. So, now we will monitor the patient in the next 24 hours kung makaka-hook na siya. Ha?
Yes.
Mas active siya, no, ngayon, kaysa kahapon.
Oo, okay sa kanal.
Kahapon tahimik.
Sure.
Lipat. Doon na lang.
No. Nakaano yung ano mo. AC power. AC power.
Doon na lang, dalawa yung
Alternating
infusion.
current.
Dalawang infusion doon.
Ito. Okay.
Meron sila pa ata. Extension.
Ano? Okay. So, two infusion pump, one for the IV line and one for the polyglycol 350 via an esophagostomy tube. Okay, we will monitor the patient and based on the scientific report,
One.
median time for the evacuation of this call is 8 hours, range of 5 to 24 hours. So in the next 24 hours, we will monitor the patient. Then we can either stop or continue the polyglycol 350. Okay. One thing to know is we must also, the purpose of monitoring, close monitoring the patient is to make sure there is no obstruction and there's no vomiting, because once those signs are observed, we have to stop the polyglycol, because one of the contraindications with laxative is obstruction. Any kind of laxative. So, tama lang yung ano nyo, 30 lang muna. Oy! Balik mo yung folder ng si Papa niya.
Nakakabit.
Okay. So, thank you for the the time and for watching.
Cut. Doon na lang po.
Isa na. Yung basta na. Ano lang. Nakaramdam siya.
Naalala mo yung isang patient natin na nagyan din natin? Sino yun? What was years ago?
Balik mo dito.
Ito na. Ito na dito.
So, ang effect niya could be, you know, parang additives, you know, additives, because the PG3350 mixed with normal saline solution. So the sodium chloride will also add to the pump of water in the colon, di ba? Because it's sodium plus the effect of the laxative. It's a soluble fiber. So the main result would be increasing the water content in the colon and to soften the stall. So without the possible contraindication or complication with this method of medication or the obstipation, hopefully in the next few hours, Coco will start defecating with the stall. Restore. Ano siya? Okay. Ang IV fluids niyan, so there is a, you know, confusion whether we have to adjust the IV, the rate of IV fluids, since we are giving also another fluids. So what's your, opinion with that? Pero these fluids, I think, will not be absorbed in the GI tract. Diba? Siya ma-absorb. So it will not add to the blood volume. So it's like subjective for me to adjust or to decrease the IV rate, the rate of IV fluids. Just because we are also giving another fluids to the GI tract. Not necessarily adjusting the rate of IV fluids. Especially for patients who are dehydrated or needs a fluid support, IV fluid support. Because the action of PG 350 with normal saline solution is to increase the fluid, volume of fluids in the colon, and that's all. Okay. Thank you.
Okay na ron.
Maingay na siya.
Okay. Let's observe for few minutes na lang, then
Yan, natok yan.
importante walang vomiting. Alam na, pag may napansin kayong nag-vomit siya, report mo agad sa akin. Okay. Pero compared yesterday, mas ano siya ngayon, no?
Mas active.
Active ngayon, no? Hindi ko nagamit to. Ano naman, pass.
Yan.
Mas alert siya.
Alert. Mas makulit. Nagalit siya kayo, nagalit siya.
Okay, muna. Okay na. Makatumatong bigla.
Nagalit siya, nagalit.
Okay, thank you.
Galit pala sa aso.
Time to... Sign out na tayo. Thank you for watching.